If your LDL cholesterol looks normal, that does not always mean your heart risk is fully under control. One blood marker that many people overlook is triglycerides. A lot of people think triglycerides are just another fat number on a lab report, but they can actually be a warning sign that something deeper is going on. Because when triglycerides are high, it often means there are more unhealthy fat-carrying particles in the blood. These particles can still contribute to artery disease even when LDL cholesterol does not look very high. So the big message is this: LDL is very important, but LDL is not the whole story. If triglycerides are high, especially in someone with belly fat, insulin resistance, diabetes, fatty liver, low HDL, or a high sugar diet, there may still be important hidden heart risk, and triglycerides usually do not rise for no reason. Common causes include poor blood sugar control, being overweight, too much alcohol, kidney disease, low thyroid function, diets high in sugar or refined carbs, and even some medications. Now let's make the numbers simple. If fasting triglycerides are between 150 and 499, they are considered elevated. If they are 500 or more, that becomes more serious. And if they go very high, especially above 1000, the problem is not just long-term heart risk anymore. At that level, there is also a risk of pancreatitis, which can be dangerous. I want to emphasize another important point. The issue is often not just the triglycerides themselves, but what they represent. They can be a sign that harmful leftover cholesterol-rich particles are still circulating in the blood. So someone can look at their LDL and think, "I'm fine," while another part of the lipid picture is still telling us there may be ongoing risk. So what should you do if triglycerides are high? First of all, do not ignore it. Ask why it is high. Is it weight gain or high sugar intake, poor diabetes control, or alcohol? Any thyroid problems, kidney disease, medication related? Because if you do not fix the cause, the number often stays high. Secondly, lifestyle matters a lot here. This is one of those areas where lifestyle changes can make a real difference. That means cutting down sugar and refined carbohydrates, reducing alcohol, losing excess weight, exercising regularly, and improving the metabolic problems driving it. Even a modest weight loss can help bring triglycerides down a lot. Thirdly, keep the priorities clear. If LDL is high, that still needs strong attention, but if LDL is controlled and triglycerides remain high, that can still mean there is leftover heart risk we should not ignore. Last but not least, not every treatment that lowers triglycerides gives the same benefit. Some treatments have been shown to reduce actual cardiovascular events in the right high-risk patients. Others may lower the triglyceride number on paper, but without clearly improving outcomes. That is why the goal is not just to chase a lab value. The goal is to reduce real risk. So, here is the takeaway. Triglycerides are not just background noise on a blood test. They may be the clue that explains why risk is still there, even when LDL looks acceptable. So, if your triglycerides stay high, do not just glance past it. Ask what is causing it. Ask what part of your metabolic health is being missed. And ask whether this number is telling a bigger story about your heart. Because sometimes the number people ignore is the one that matters more than they realize. Follow Decoded MD for clear, evidence-based explanations of what heart studies and lab numbers actually mean for you. I'll see you in the next video.